You good.
Alright, good evening. My name is Sergeant Keith Faith, and I'll be giving you an informative presentation on diabetes. To inform people on the types of symptoms and treatments of diabetes. You ever wonder what it'd be like to have to be around needles all the time and watch what you eat and all these sugary foods that most people like? These are the type of things that people with diabetes have to deal with every day. I mean, you can't eat certain types of foods or else you're going to do like a sugar shock. You have to inject yourself with insulin depending on what type of diabetes that you have. It's just everyday life is a challenge for people that are diagnosed with diabetes, and it's more of like a tasking to their, whatever it is that they do every day. Diabetes affects 2.8% of the population in many cases. There are many causes to to how you would go about treating your diabetes. Being in the Army, you don't deal with diabetes as much because you're not allowed to have it in the Army. But if you were a civilian, you would have to be around people with diabetes, and you may not know it, but if you would know who is diagnosed with diabetes, who has diabetes, you would notice that their lifestyle is different than the average person. But being in the Army, we're not faced with it all the time, so in the civilian sector, it's probably more of a effect, I guess, to your employer or to your job, or however your community, people have diabetes. I have an aunt who she's a type 1 diabetic, and she has a machine on her body, and it pumps insulin into her like a couple times during the day, and it's a challenge to her too because she can't eat a lot of sugary foods, and like, imagine just having a machine in you all the time that pumps insulin into you. I mean, that's just got to be disturbing, and then you got to yourself, and it's just, I have a first-hand experience, having her as my aunt. I know what diabetes is all about. But most people, they have to where, they give themselves injections worth of insulin, or they take orals, to kind of help themselves out. Diabetes is when insulin that is needed by the body is not produced or is rejected by certain cells in your body, and you need insulin in your body to produce energy for the most part. I mean, that's why you need insulin. So I'm going to go ahead and explain the different types of diabetes. There's type 1. It's a result of the inability to produce insulin. Your pancreas doesn't produce insulin, so therefore your body cannot naturally form its own energy, and like I said, the cells just don't even produce it at all. And like I said, it's usually diagnosed in children and young adults. Only 5 to 10% of diabetes or diabetics are type 1, diagnosed with type 1 diabetes. It's known as the juvenile diabetes. Young children, with proper treatment and and medication, they can live healthy, full lives. So like I said, most young children are diagnosed with type 1 diabetes. And type 2 diabetes is when the body rejects the insulin. So like your body, your pancreas will produce the insulin, but your body rejects it, and therefore it's just a reaction that your body does to where it doesn't want to accept it, and then you feel like sluggish, and that's when you have like sugar shocks and all that types of stuff. More people have a higher risk of being diagnosed with type 2 diabetes. Like I said, type 2 diabetes is also more common in African Americans, Native Americans, Hawaiians, and Pacific Islanders. So it has a little bit. There's different treatments, and there's different effects, like with the type 2 and the type 1. And then there's gestational diabetes. It's during pregnancy, around 28 weeks or so, some females will develop gestational diabetes, and it's when the body doesn't want to produce the insulin, and it's more or less like an effect, like when you're giving birth, and you'll get diagnosed with it, and then you can it'll either go away after the pregnancy, or after the pregnancy you'll get diagnosed with type 2 diabetes. So it really all depends. I mean, it's treatable and it's curable, but and it resembles type 2 diabetes. It occurs in about 2 to 5% of all pregnancies, and like I said, it's fully treatable, and this affects 20 to 50% of women, and 20 to 50% will also have the diabetes after the gestational diabetes some types of diabetes. Type 2 diabetes is a certain lifestyle and genetics. It's genetics. You can be born, and eventually it'll develop, and you'll be diagnosed with diabetes later in life. Or it's your lifestyle. Like I said, if you eat a certain way, or if there's a certain lifestyle that your body consumes, like a certain amount of I guess effective foods or drinks and stuff, you can be diagnosed with diabetes. Type 1 is inherited, but sometimes it can be due to infections and environmental factors. Like I said, so that's another thing you can acquire. Gestational is just a low result of levels of insulin, and like I said, it's just when your cells don't respond to the insulin that your pancreas is producing, or your pancreas isn't producing enough insulin, and your cells don't know how to react. So like I said, then you start to go into shock, and it's not good stuff at all. The treatment for diabetes, like I said, diabetes is a chronic disease and is difficult to cure. So managing involves monitoring your blood sugar levels, proper use of insulin and medication. Like I said, they got oral meds, and they got, like I said, intravenous. I guess as you would say, you would use intravenous. You would use a syringe, and you would inject it into your thigh, or some people use their hip. So I couldn't imagine myself having diabetes and having to just stop what I'm doing to give myself insulin. Dietary management and exercise, like I said, you don't want to get overweight, because then your body doesn't know how to handle all this extra weight, and especially when you have diabetes, that can lead to implications. So like I said, your diet, and your exercise will help manage your diabetes, that you have. Like I said before, insulin is used. Like I said, you inject yourself with insulin with type 1 diabetes treatment, and insulin is prescribed. Insulin is a prescribed medication used for type 2 treatment. Like I said, they got oral meds for type 2 diabetes, so you really don't have to inject yourself. But just to kind of like a back brief on the insulin. Like I said before, it's a chemical for the body that's able to use for glucose for energy, which is basic fuel for cells in the body. Without your insulin, you're not producing any energy for yourself. Some signs and symptoms that you might have: diabetes, frequent urination, increased thirst, increased hunger, and vision changes or blurred vision. There's some of the symptoms that you might want to get yourself checked out, as you might have diabetes. In conclusion, diabetes is a common disease that is treatable, yet not at all times curable. And with proper treatment, even young children can live normal, healthy, happy lives. Even though this is not curable, it can be treated, in most cases preventable from death. That concludes my presentation. Thank everybody for coming out. If there are any questions someone might have,